I want to make sure I answer any questions you might have for your own spine. Like, you're in charge of your body. What can we do to help it? My name's Justine, and I'm a yoga teacher and a yoga therapist, which basically means I've studied a lot more and am a anatomy nerd. So that's part of my training. The other part of my training is I've had a lot of injuries. I've had 2 knee surgeries. I have degenerative disc through my spine, and I have lumbar disc damage where one, like this little guy, this is a bulging disc right here. I mean, pretend this little red spot. So in my instance, the disc bulges straight back, which isn't all that common. Usually it goes to one side or the other. But when it goes straight back, that means it's going into the spinal canal, which is where our spinal cord is housed. Which is, ironically, the only thing on my body that is small. The MRI report says, you know, unusually small spinal canal. And I'm like, really? Come on. So there's 2 things. First I want to start, has anyone here ever had back pain? Right? Yeah. I had a friend who was 60 and she goes, you know, I'm lucky, I've never had back pain. And I'm like, now she's also 5'2" and I'm 6'3", so there's a little bit of a difference, but I have to say I was quite jealous of her. Anyone have any diagnoses like disc damage, bulging disc, blown disc, stenosis?
Stenosis works.
Yeah, stenosis. Yeah, I remember when I had to look that up, and I wish I only knew about it from reading about it, but sadly, yeah. So there's 2 different kinds of spinal stenosis, and really, spinal stenosis is a fancy name for osteoarthritis in the spine. And you can get central stenosis, which is the central canal, where bone starts to grow in and create a smaller canal by almost, not suffocating, but impinging on the spinal cord. Then you have foraminal stenosis, which is where the osteoarthritis is in the foramen where the nerves come out. So this can be due to misalignment. If someone, which by the way, I put my back out when I was 15, continued to work out, I was training for sports, continued to work out without putting it back in. So I developed my muscles out of alignment. Then the chiropractor would put it in, my muscles would pull it out. So that all started very young, and again, I'm 6'3". The longer a spine, I mean, just like any road, the longer a road is, the more maintenance you have to have. And I used it pretty hard. I had an older brother who used to think I was a wrestling teammate, and showed horses and played basketball, and you know, life, it gets all of us. So we'll talk about spinal stenosis, but continue to think it's similar to osteoarthritis. And what's nice about osteoarthritis, I always tell people, this is kind of my little support, you know, so I'm not alone up here. I always tell people if you have arthritis, osteoarthritis is the one to have. Just because there's more that can be done for it as opposed to rheumatoid arthritis or something like that. That doesn't mean it's fun, but we can manifest change in a positive direction. And how we do that is through movement, mainly gentle movements linked with breath. And that's the key, is the breath. If we're just moving, that's helpful to a certain extent, but it's the breath that gets all the physiology working together to help basically break down the osteoarthritis. So I'm not saying the osteoarthritis will completely go away, but you can either stop the progression of it, and in some instances, like I would love to see my MRI now as opposed to, let's see, I think it was 6 years ago when I had it. I think mine might have improved. I'm not gonna go get one just because it would cost a fortune, but I think I have made some positive change in my spine. That being said, sometime last summer, for instance, I got a little, shall we say, cocky, and thought, oh, you know, I've been doing so much yoga, my back's been doing well for a long time, and da da da. and then it went into spasm. Anyone ever have a back spasm? That's fun for all ages, isn't it? Yeah. And it's the body doing something good. It's trying to stabilize and stop more damage, but there's no off switch. And when you have compounding issues, it's not just a muscle spasm. If the muscle spasm pulls the vertebral bodies together, that smashes the discs more, which might make them bulge more into the cord or into these pesky little nerves. And having nerve, has anyone ever had that experience where you take a step and you feel that nerve pain and it drops you? That's no fun. So what I like about yoga is it gives us the opportunity to take our health somewhat into our own hands, which doesn't mean we're not working with our doctor or a physical therapist or my favorite healthcare provider, the massage therapist. I just happen to love that. But we can do stuff also, because when you're hurt, what's the first thing you want to do?
Sit down.
Well, yeah. She's going right for the gold, yeah. Yeah. It's like get out of pain, but part of it is I'm hurt, so I'm not going to move. And then everything kind of cements in even more. And I had that instant I had last summer. I was feeling a little confident because my back had been doing well for so long. And I did something extremely stupid in a yoga class that I knew better than to do, but I did it anyway. And my back went into spasm. And just when I almost had it better, my cycle started. So I learned through a wonderful, Google this, no problem. But I learned that the uterus is connected by fascia. I'm sure Sherry's been talking about fascia. To the psoas, which is the major hip flexor. The psoas starts around T12, connects to the side of all the vertebral bodies, also to the discs. Learned that one the hard way. And then the QL, which is a deep muscle in the low back that lets you do this. But it's a huge muscle. Those spasms pulled everything together. I couldn't move. I could, but it was excruciating. So it takes a while for that to release. So I learned not to be overly confident. I still have injuries in my back. And it took me a while to get out of that because I did not want to move. That being said, anti-inflammatories, heat packs, ibuprofen, muscle relaxers, essential oil, a little bit of prayer, a little bit of everything. But I got back, was able to teach. But it was probably a good 5 to 6 months before I wasn't afraid anymore. I mean, does anyone have that feeling with any kind of severe pain? But I find spinal pain to be this kind of primal fear because it's your very core that everything connects into. So what I want to do today is give you some safety cues while you're in classes to keep the intervertebral discs healthy. And my way of teaching is, if the body is our temple, this is the altar, the spine. And if you keep the altar clean and tended, it's where everything plugs in. So everything's going to improve. If you're creating space, creating circulation, circulation is the only thing that heals. If we don't have circulation, we can't heal. So the intervertebral discs, this was a bit of a shock to me. They self-hydrate until you're in your 20s somewhere. And then all of a sudden, they quit hydrating. And so the only way they get hydration is through movement. And you have the different movements of the spine. Flexion would be going forward. Extension is going backwards. Rotation, which is the twisting we do in class. Lateral bending, which, and I think Sherry talks about this, like, you don't exactly walk into your kitchen and go, oh, I'm gonna grab something out of the, you know. We've got to do that consciously to move the body in all directions. Yeah.
Oh, yes, I do.
Yes, you do. Yeah. And then
we should start.
Inverting, yeah, exactly.
Scare our family.
Yeah. Yeah, no kidding. And then one of my favorites, which when the first time I heard it, I had no idea what it was, and that's axial extension. So this is axial extension. See how, and I'm good for, I have a severe kyphosis in my spine here. That's only because of how I tend to sit. And I was always tall, so I always sat. I tried to be smaller. That's not real. Axial extension is this, like someone's pulling you taller. So gravity affects us. Anyone, there's so many jokes, I'll just let it go. But gravity affects us. It's what keeps our bones strong, but it's also what squishes us. Mm-hmm. And it's what squishes the vertebral bodies down, which means these discs, which are like shock absorbers, thin. So they can thin just through being on the planet. They can also thin by being way too aggressive in your sports, or I have a lot of Marine friends, and wearing 90 pounds on your back, and that will compress your spine and all the intervertebral discs. So that's one thing we're going to work on, but then also, if your back is acute, meaning you're in severe pain, the safest way to work with your back is when you're on your back and it's a flat surface. Because I'm just going to show you guys, this is a lining for the spine. And one of my favorite things to do when I get home is to put my legs up on the couch like this. This is the same as at the wall that Sherry has you do, putting your arms like this, and if they hang up, put pillows or a blanket underneath them. But guess what's happening right here? All this blood is going into the pelvic area, increasing circulation, helping to heal, as your spine is aligning with the help of gravity in the floor. Now, if you're injured and you need to do a forward bend, my spine is stable. This is a forward bend. It's the same as if I were standing and went into leaning over. So bringing the knees into the chest, anything like this. And part of the reason I'm telling you that, who here has done yoga in their bed?
Yeah.
Right? Sometimes that's the best we can do if we have trouble getting out of bed. I've even created for clients a little fort where they can do this in bed, where they have, it's kind of funny. It takes a lot of pillows, but you can do it. That being said, a lot of us come to chair class. And I love chair. Do you remember the first time I was teaching a class on osteoarthritis? It was a series. And one of the days I thought, I'm going to use the chair. And I had it all set up ahead of time, come in, and I have the chair out, and Miss Linda comes in, oh, the chair, no, we can't do the chair, come on. And I'm like, and at the end of class, she was like, okay, I'm never saying anything about the chair again, because who knew you could go so deep, right?
It felt like I'm old, you know?
Yeah. I mean, I didn't want to address
Right.
getting older, and I thought it was only for old people. But the chair
Yeah,
can be
has
very
anyone here been
challenging.
sore from doing a chair class? I have for sure.
Yeah.
You can get in very deep.
Yeah.
One of the things, so who here has lower back problems?
A little bit.
A little bit, okay. Anyone have upper back problems? Okay. Thoracic or more the neck? The neck, okay. Okay.
Yeah.
Mine's not bad.
When you say problems, do you mean pain? Or do you-
It could be pain, it could be compression of the discs, spinal stenosis, cervical stenosis, SI joint.
Right, but it's the upper back.
The upper back, usually it's a muscular thing, unless it's degenerative disc. There's something called degenerative disc disease. And that is most likely, sometimes it's from wear and tear, but it's also hereditary. And I think they only MRI'd me from like mid-thoracic down, and at age 37, from mid-thoracic down, I had degenerative disc. I can only assume it's up as well. what to do. You know, I'm doing everything I can to reverse that. With the thoracic spine, we have the rib cage. If we didn't have the rib cage, the thoracic spine could almost spin around. It would have so much mobility. But we have this rib cage to protect the important organs, the heart and the lungs. And that keeps us limited in how much rotation we have, how much extension, how much flexion even within the thoracic spine. It's rare for a blown disc to happen in the thoracic spine. I've had students who have, but I had one student who had, every time he came, he's like, oh, I had this, and he was probably 50 at the time, and I'm like, your poor mother, you know, he had gotten into so many motorcycle accidents. But that will do it because of the trauma going sideways. But there's a lot of muscular stuff going on up top from this. And I'm a perfect example of what not to do. I already have this. I mean, can you even hear that in my voice? Versus lengthening. Wow, that's pretty profound. And I don't need to lengthen or deepen my curve. I need to work on, and I've actually grown a ½ inch after I started yoga. Really, you know? Yeah. So one of the things I really want to talk about, and I'm going to turn sideways so you guys can see this. Well, anyone ever see this kind of posture?
I'm going right now.
Yeah. And that what is happening is the front of the vertebral bodies are being pushed together. The disc acts like a cushion, and so if there's pressure to the front, the cushion pushes to the back. If there's pressure to the side, it pushes to the other side. When you're leaning forward like that, it's pushing it out. If you already have a bulging disc, that could blow it. Probably not sitting in a chair, but if you're sitting in a chair and then, like that hurts. I already feel that in my back to go forward. So what you need to do is sit up nice and tall and almost scoot your butt back. So you get that little hollow in your back. So let's all try that. Sitting up nice and tall, shoulder blades together. This kind of a forward bend is safe, even with disc issues. Now, I'm not acute right now. Hopefully I'm cute, but I'm not acute. When I am acute, I probably would not do this. But you inhale tall, exhale, you want to make sure that the pelvis is going forward. And it might be, if you have disc damage, that you stay here. Because look at my back, and maybe even feel your own back. It's got that flatness in it. As soon as we start to go forward, it might round. I can do that now, and maybe some of you can, maybe some of you want to stop right here. Just to feel that lengthening. And I like to do what I call a little dance with the breath, where you're in the pose, you could just kind of hang out here, where you could inhale, lengthen, exhale, pull the belly in. And that deepens the stretch for me. Not sure if you guys can feel that. Inhaling, lengthening.
Yes, yeah, feel it.
Inhale, lengthen, and then exhale, really pull the belly in and come forward.
That lengthens, I feel a stretch.
Yeah, yeah. And you can get into some of the deeper intrinsic muscles. Now with an inhale, come back up. Now notice how I said pull the belly in. If you're not pulling the belly in, your low back muscles are going to have to overwork. And they do that a lot. Anyway, if you're American, I'm pretty sure, really if you're Western, I'm pretty sure your back muscles are overworked and your stomach muscles because of how we live our life. Watching TV, you know, the whole thing. In India, they wait for the bus in a full squat, and I've seen them there I'd watch them like 10, 15 minutes playing games, playing cards. I won't do it because my knees, I wouldn't be able to get back up. But a full squat where their feet are flat and they're, yeah, but guess what? They have open hips and very little back pain. I love culturally knowing like what different countries have different issues. Because of how they do that, one of the bigger problems in India is flat feet. because when you do that, your arches fall. So, you know, you win some, you lose some, you know. We can't win everything. So, one thing I want to talk about, now, spinal stenosis ladies, I know you're one. Anyone else with spinal stenosis? Okay. With spinal stenosis, if you do a forward bend, especially if it's foraminal spinal stenosis, look what happens. Sorry, you can't see through my hand. Look what happens to the, as I'm leaning forward, this versus this. There's a little bit of space that opens up here between these little notches that come off where the nerves come out. With stenosis, that creates more space for the nerves, so forward bends feel really good. Back bends, on the other hand, can really trigger a spasm. Because you go into that nerve compression and your body goes, wait, we gotta put the brakes on, let's freeze this. Disc damage, the best thing is laying on your stomach, using the strength of your core, and inhaling coming up. So what heals one hurts the other, and vice versa. Really, you know? So you just have to limit how far you're going in one direction. And one thing I like to tell people who come to my classes, I teach a lot of people with injuries because I teach yoga therapy classes. And one thing I tell them when they first come, this poor guy probably is going to have scoliosis by the time I'm done with him. But when they come, I say, whether it's me or any teacher, if it doesn't feel good, do not do it. Because I cannot be in your body. Now, when I'm working privately with someone, I can somehow get a little bit into their body through communication. And I've had a long-term client who's a retired English professor. I have learned a lot from him because he's so articulate. And I'm like, what's going on here? What's going on here? And you learn to figure things out through that experience, because I don't want to have every injury on the planet to learn. You know, it's the best way to learn, but I do not recommend it. Any other issues we have going on, like sciatica, SI joint pain, anything? Your husband? Okay. SI joint pain, what you want to be careful of, and I would say even putting a block between your thighs, it is very difficult to hurt yourself doing this. As soon as I do this, then you can really hurt yourself. Using your core strength, you guys all want to try it? Let's scoot a little bit forward, if that's okay for your back. You can also keep the low back on the floor. Have your feet, I'm just checking, okay. Roll the shoulders down and back. You're going to have your arms up. Inhale, always that axial extension, lengthening. Exhale, pull the belly in, turn towards either side, really. Inhale back to center. Exhale, turn the other way. Inhale to center. Exhale, turn. Inhale to center. Exhale, turn. Good, and come back to center. Now I want you to try this. Rather than just pulling your belly in, pulling the belly button back, imagine you're wearing very tight 80s jeans. Did you guys ever do that where you had to lay on the bed and the jeans came all the way up here? Yeah. As you exhale, you're going to start like you're zipping up your jeans from the pubic bone all the way up. And then as you inhale, coming back to center, soften the belly from the top down. That's going to help develop your core, and it's way easier than doing crunches. So let's try that a couple times. Inhale tall. Exhale, pull the belly in like you're zipping up the jeans as you turn. Inhale back to center. Exhale, pull the belly in.
Like a pelvic tilt.
Inhale back to center a little bit. Now let's do it a couple times with no movement. So you're going to inhale, maybe even consciously let your belly expand. Then exhale, pull the belly in like you're zipping up those jeans. And then inhaling, softening from the top down. Exhaling, belly in. It's a little bit of work, huh?
I have a comment, Justine.
Yeah.
Much easier to do this on a chair than it is standing
Yeah,
Much less pain on my back.
good. Linda has SI joint issues
And lower back.
and lower back. Just so we know, does everyone know what the SI joint is? It's short for sacroiliac joint. So, yeah, sacrum is the little triangle bone at the base of the spine, sometimes referred to as the sacred bone. One of my friends calls it that, and I think that's beautiful. And then the iliacus is the hip. This is the big, well, I'll speak for myself, the big. This is the SI joint, sacral iliac joint. So it's where the legs are glued onto the body. And when we walk, we transfer almost 100% of our body weight through that joint. So when it's sore, there's a couple of us in here that know what that feels like. It's no fun.
No.
And if it is sore, there's stuff to increase circulation and bring it back. But this sort of thing puts shear stress on the sacrum because one hip's going forward, the other hip's going back. So suppose you're in a class and that's going on, you modify here. So even if they're doing a warrior one, maybe you can modify here and do inhale, exhale. So you're still getting movement, but you're not really putting shear stress on the sacrum. Make sense? Okay. Just because sciatica can be another fun for all ages, the sciatic nerve, and there's information on this sheet. Seriously, I gave this to Sherry yesterday and she had this amazing showing the nerves, and I mean really, in less than 24 hours she put this together.
Thank you, Sherry.
Go Sherry! Yay! So you can see the nerve, it's on the back sheet with the picture of the pelvis. You can see the SI joint in that picture. And then you can see the nerves and that big thick nerve on that page. That's the sciatic nerve. The sciatic nerve, the orange in this is the sciatic nerve. But this is the little bugger we're concerned with. It comes out of the sacrum. You can see where it comes through the holes of the sacrum. And then it binds into one big nerve. It's the biggest nerve in the body, the nerve of it. See these two muscles? This is our friendly or not so friendly piriformis. And the sciatic nerve runs through there in between the pelvis and that muscle, if you're lucky. In some people, it runs through the middle of the piriformis. So you can imagine when the piriformis tightens around that, that's even worse than if it's right next to it. So this is the pain in the butt muscle. And this is the muscle, if you want to feel it, I love these things. These are like my little toys. Go ahead and sit back. I'm a big stickler, I have to say. One of that same client who's the retired English professor, he would say, well, here I'm rolling back if I'm coming up like this. And I would say, I'm glad you're rolling back into the chair. Let the chair support you. Because that's a lot better than rolling back and not having that support of the chair. So if you tend to have tighter hips, stick your butt back like you're almost pointing it back to the wall behind you. Okay. Then we're going to bring, let's bring your right knee up. And if you have tight hips, scooch your other foot a little bit further away. That will limit how much the stress is. Keep that ankle flexed and you're going to cross over. Flexing the ankle protects the knee on that side. From there, interlace your fingers around the knee and you're going to pull that towards the opposite shoulder. Can you feel that in your high knee? Yeah. Going back and forth like this a few times will pump blood into that muscle, which is a good thing. It sounds creepy, but you want to get a little bit of circulation in it before you stretch it.
If I do this, I cannot do it with this leg, my hip is.
Oh, thank you for that. Thank you for that.
Mm-hmm. I mean, this one, I cannot do everything. This
No.
one is 2 years old and I can do anything, the new technology.
Can you go past the midline?
No.
Yeah. Then I would say maybe even here, lengthening and going this way, so that you're trying to get a little bit into the
Yeah.
butt.
Okay,
Yeah,
this way?
yeah. It's a little more difficult when you can't do that. But if it's anything like your other hip,
This hip I can do it.
yeah,
Mhm.
yeah, it's amazing.
Because it's just 2 years old. Technology, this is 5 years old and totally
Oh, okay, yeah, yeah.
different. 2 different doctors.
Oh, yeah. Now, if you were to want to take that deeper, you can come axial extension. Notice how that might just tilting the pelvis forward, I can feel it more. Maybe a little bit more. Now we're gonna put our third eye on the ground. Just kidding.
We'll put your third eye.
Yeah. And then I read an article that I just liked how they say it, because I'm always saying like, breathe as if your lung is in the tight part of your butt, and I read this article and it said, breathe as though you're blowing air into your lung, into your hip, like you're blowing up a balloon. The air isn't really going there, it's going into the lungs, but that visual, it helps me.
So are you saying that if you have sciatic pain, this would ease it?
Thank you, that's a great question, yes. And go ahead and come up and we're gonna uncross. So she asked if you have sciatic pain, if this would ease it. In most instances, the same client one time, that was really tight for him. And I said, oh, that's awesome, because I know he has disc damage in his back. And he looks at me like I'm nuts, and he goes, why is that awesome? I said, because it gives you 2 areas for relief. That is, in my experience, the main culprit of sciatica is down here. However, true sciatica is defined from the lumbar spine, where there's an impingement of one of these branches coming out. So it's very different treatments, but I find that even if that's your source, stretching the piriformis gives you extra relief. If it's from up here, lying in bed, hugging the knees into the chest, and repeating that. So you would inhale, soften the belly. Exhale, pull the belly in as you draw both knees into the chest. And then inhale, release. Good. Back and forth. And what that does, it's kind of taking the discs, opening and closing, opening and closing. And it's almost like, I never know what this is called, like a hydraulic thing where you kind of pull and push, pull and push. That will imbibe the discs with fluid, which pumps them up a little, but it also increases circulation, and you're pulling these little vertebral bodies apart, and then they're coming back together. And linking that with the breath can help to break up some of that osteoarthritis. There's also supplements you can take. I had a woman who was a retired dancer who was a student of mine, and she had arthritis throughout her whole spine. And her hips, her shoulders, her hand, I mean, she had arthritis pretty bad. She started drinking shots of apple cider vinegar. Swore by it. Yeah.
I do too.
Yeah, that stuff's amazing. And you can even make it into a tea.
Yeah.
I'm not saying it's, you know,
Yummy.
a chai, but it's tolerable. But no, that's a great question. So there's 2 areas for relief. Do you happen to know the origin of your sciatica?
I don't have it, it's my brother-in-law has it.
Ah, okay. One way to check, first, I know I talked a little bit more, but close your eyes and see if you feel the difference between each butt cheek from that first stretch we did.
I do.
Yay.
I came in here with a tightness in here.
Yeah, good. Go yoga. Okay, we're gonna do the other side just for kicks and so that you can get, yeah. So pull your other leg up into your chest, and then you're gonna cross over. And remember, if it's super tight, you can scoot that bottom foot away and that will lower the angle. And then I'm a stickler for keeping your knees healthy, so keep that ankle flexed. And you're gonna pull that knee up and let it come down. One way to test, your brother-in-law can do a self-test. If he tries this and it's super tight, we'll know at least part of the problem is from here. And then the other thing I would ask him is if he has disc damage in his low back or spinal stenosis. Either of those can manifest as sciatica.
I think he's so scared he doesn't do anything.
Right.
He just puts up with the pain.
Yeah.
I
Well,
have
and
a
it's-
question. Is this just on one side that what you're talking about?
No, we haven't,
Is it on both sides?
it's on both sides, so
Yeah.
this only has one
Okay.
half of it.
So you
I
can
could only
have it on
afford
both
half of it.
sides.
Yeah.
Yeah, so this would be a mirror, a mirror image on the opposite side, this little,
Uh-huh.
Mhm.
I didn't know.
Yeah, no, that's a good question. And then, if you're already at your edge and really feeling it, you can stay here, or you can lengthen, but remember, you want your pelvis to tilt forward. Can you? Yeah. Good. And the breath is the key. We tend, when I say we, I mean me, typically if something's intense, I'll, but as much as we can remind ourselves, because it affects a lot, including the nervous system, and the nervous system, will start to go, oh, warning, something's going on, I better tense up.
But I like that breathing into that muscle. It really feels like the air
Yeah.
moving
Yeah. And when you're ready, coming up. And I noticed that Linda is sitting this one out. And that is because even though we're not necessarily weight bearing, her SI joint is a little inflamed right now. This is putting a little bit of stress on the SI joint. So she's done yoga long enough and has had her body long enough, she knows, don't do that.
I did do it with the other leg. I did it
Yeah.
with both legs, but it was like too much.
Yeah, yeah. Now let's take our legs wide, stick your butt out again. Really, almost like you have a tail feather and you're scooching it back. Take your tail feather, okay.
That's a visual.
Inhale tall, and then as you exhale, come forward again. Each time you inhale, think of lengthening, and as you exhale, pull the belly in. Then with an inhale, come back up. I should have done this. Usually I do this at the beginning of class where you close your eyes and check in with how you feel. So I want to do that now, and we're going to do some stuff for the neck. First, I want to ask, does anyone here have, well, we've all been on the planet a little while, so I'm guessing most of us have some sort of osteoarthritis in our neck, just because that's how necks roll, yeah. So again, we're going to do some twisting, gentle, within a comfortable range of motion. But what I want you to do is close your eyes and just bring your awareness into your body. Notice how your neck feels. Notice if there's any tension. And then when you're ready, open your eyes. We did that twisting earlier. My teacher calls twists, he compares it to flossing your spine. It's like you're taking and dusting little pieces out between each vertebra. So now we're gonna floss our neck. So again, remember, it's always, if you're like this and go into a twist, there's compression and there's all sorts of room for something bad to happen. Like, a nerve get pinched, a muscle contract. You always wanna act like someone's pulling you up like a puppet. So you're gonna inhale tall, exhale, turn your head to the right as far as is comfortable. Inhale back to center. Exhale, turn your head the other way. Inhaling to center. Exhaling, turning left, right, sorry. Inhale to center. Exhaling, turning. Inhale to center. Exhale, turn. Inhale to center. Exhale, turn. Then come back to center. Close your eyes for just a moment and notice if that had an effect within your neck. Anyone notice anything? A little bit. It doesn't take a lot. Even when I was going through my training, my teacher said, and it was our homework, we would design a practice for ourselves to do 20 minutes every day. Because I'm having you do 20 minutes because then you might actually do it. I wish I had time to do a 2-hour practice every day. I don't. Sometimes I don't even have time for the 20 minutes. I can't say that. Sometimes I don't even take time for the 20 minutes. But it doesn't take a lot of time to effect change that's positive for our body. So it could be that you just finished lunch. Well, you're just getting ready to have lunch because maybe you don't want to bend right after you've eaten. And you're just gonna, do some hip circles and maybe stretch your piriformis. Maybe you are waiting for something to cook on the stove and you do some lateral bending, back and forth. Linking it to your breath, really pulling the belly in to help strengthen your core.
Sherry will get a kick out of this, but because I have a lot of arthritis in my hands and wrists,
Yeah.
I've taken to now when I come to a red light. For however long the red light's there, I'm doing this,
Yeah.
and it's like I'm not looking at anybody because they're probably going, you're weird. But that's one of the things that I
Yeah.
started doing.
Yeah.
And it makes a difference.
Yeah. And part of that reminds me of a metaphor that I really like. And this would be good to share with your brother-in-law, and trust me, I know his fear because I've been there. And it's kind of the devil you know is better than the devil you don't know. But if you think of a little pond that has no water running through it, there's no wind, it's hot, there's moss kind of growing on it, would you want to swim in that pond?
No.
Probably not. But if there's a pond that has a little rivulet going through it, the wind is kind of moving the water, circulation is happening, that's probably a lot more inviting. Our body's the same. When we don't move, we get accumulation. Joints are very much kind of like roundabouts where the traffic jam can happen. Anyone remember roundabouts? I wish we could get more of them in here. Yeah. But that's where the traffic jam can happen. So the reason that's helping her hands is we're creating movement, which creates circulation. Because the process in the body is you start to get accumulation, and then you get stagnation, and then you get dis-ease, which could be dis-ease like discomfort, or it could be disease, where stuff starts to come up. So always think of that like, okay, I'm gonna irrigate my hip, any sort of movement. And a lot can be done in bed. First thing in the morning, pull one knee into your chest, take a couple drinks. Take a couple breaths. Pull the other knee into your chest, take a couple breaths. Maybe doing some gentle twisting in the bed. I want to cover this because twists are wonderful for the spine. But as soon as we start to leverage, you can go too far. That's when we're sitting up. Now, a twist in bed is lovely, but gravity might pull our knees all the way over to the sheet, and our spine might be like, dude, that's too far. Because what happens when it twists, so does the intervertebral disc. If you have disc damage, twists are contraindicated. But I'm gonna make a caveat, because when I really hurt my back a few years ago, I cut twists out. I got more back pain, because then all of this was so stiff, it was pulling everything together. So I made the twist safer for me when I'm acute. Now, when I'm not acute, I can do twists pretty good. I have to be careful not to get, again, too confident, thinking, oh, I'm better. But we can block how far the twist goes by putting a bed pillow underneath our knees. So say you're down here, This is a lot of rotation in the spine. But if I put a cushion down there, then I can relax. My body trusts me because it's sinking into something. And proprioception, yay, thank you. So proprioception will calm down and I can relax. And what is stretching is the muscles, but guess what else? The sciatic a little bit, but it's an F word. That's fascia. Yeah. And that's what takes longer to release. And the process of aging, one of the teachers that I've read a lot of his stuff and I respect his work a lot, he calls the process of aging basically the fascia contracting. Because as we move through, even if we're not very active at all, you pick things up, you move a little bit, the fascia stretches and gets micro tears in it. When we sleep, that heals. So think of, you tear a piece of cloth, you sew it together. You tear it again, you sew it together. That cloth is gonna shrink in. The same thing happens. That's why we do yoga, to smush the fascia, uncontract the fascia. Make sense?
Yes.
I want to make sure I answer any questions you might have for your own spine. Like, you're in charge of your body. What can we do to help it? I got my passport photo done on the way here, and the guy goes, "Can you duck down a little?" Because I was above the screen. Really? Oh, well.
I have a question.
Yes.
For a friend of mine. If you have stenosis and spondylolisthesis, what,
Not spondylosis, but spondylolisthesis. Okay.
yeah.
I would want to see how severe the spondylolisthesis is. Just so you know what we're talking about, spondylolisthesis is where one vertebral body is forward of the other, which can be mildly annoying or can paralyze you, depending on how far, because when the vertebral bodies slide, this is the payload that also gets constricted. That's our spinal cord. So I know people with spondylolisthesis that I immediately said, you should get surgery because the risk was too high. I know someone who's been dealing with it, she's in her 50s now, and we've worked with it to where you stabilize the muscle around it, and that has done her fine. But it depends on the depth of it. Do you happen to know?
No, I don't know. I just know that he has both. It's my husband.
Oh,
And he has
okay.
both. And I mean, I know that the doctors say, you're a mess, and that's basically what they say.
Wow. What I would say, typically with spondylolisthesis, that being said, sometimes it slides back. So I would be open to look at his MRI actually and show you some things that he can do. But I don't want to tell you to do one versus the other because depending on the sliding of it, if you do a forward bend, it will help one, it will hurt the other. And the stenosis,
That's the pain of it, yeah.
So he has central stenosis, or both.
I don't know if he has both or not.
You know what? Hopefully he's lucky enough that the stenosis is caused just by the vertebral sliding and it's not foraminal stenosis. But it would make sense that if one has slid forward, you're gonna get stenosis in here as well because I think the safest bet for him is lying on a flat surface, I mean his spine flat, like bed, pulling one knee into the chest
And he
and
does
doing
do
the other
that.
side.
He does do
Yeah.
that.
Yeah, that typically will get space. Not cool. Yeah.
Can you give us more movements for relieving arthritis in the neck?
Yes, yes. What was your question?
Because I have upper back muscle pain, but then very, very low sciatic.
Okay. Okay, I'll do some neck movements and then we'll get into that. Sherry does a lot of awesome things with you because I've stolen some of them. Basically, excuse me for just a minute. If you have, the main thing with the neck is reversing gravity. So if you're sitting like this and doing movement, I can feel that compression on my own. So really lengthening, and the cue she gives to push the head back and really elongate, even lifting, like you're lifting your head up off to create space. Then having had that, this is an awesome picture of you guys all pulling your Once you have that space, I'm a big believer in all directions, as long as it's not pain. Linked with the breath. Inhaling, maybe going back slightly, but you can get that backward compression. So if you get any pain at all, just to axial extension, and then exhaling, coming down. And I would say bring your chin back towards your throat as much as you can, so you're opening wide there, and then inhaling up. Then linking it to breath, going side to side. And then the lateral movement, because the lateral movement, again, unless, when we had regular phones, we probably got that more, which was horrible for this side, but you'd at least create space on the other side. Now, we don't do a lot of that side to side. So it's inhaling, exhaling over. Inhaling up, exhaling over. I like to view it almost like you're dusting inside and you want to come from every direction. And one way to even think of it is you have like a paintbrush sticking off your head and maybe even a smaller paintbrush on your chin. And you want to paint an arch on the roof or the ceiling, going back and forth, so that you're not doing, that's beneficial, but that would be another movement. So going in all directions. The other thing that compounds osteoarthritis is tight muscles, because tight muscles pull your body out of alignment. So if you have tight shoulder muscles that are constricting you on one side, that's why we can isolate the neck, but in order to deal with the neck, we also need to deal with the shoulder. In order to deal with the shoulder, we need to deal with the thoracic spine. In order to deal with the thoracic, and so on, all the way down. So, and that's one of the things I like about Sherry's classes. I've been reading through all her chair manuals, and one thing I like, and she tells this to other teachers, is I don't know where someone in particular, especially if there's 25 people in the room, I don't know where one person is hurting versus the other. So I try and do a whole body workover, where you're doing the neck in all directions. You're doing the shoulders, the torso, the hips, the knees, the toes. Because my guess is, out of the demographic, one of us is hurting in separate areas. We probably all have some commonality, but then we also have some non-commonality. And I like that headrest push just to strengthen the neck so that you can hold that posture more easily. Because from years of doing this, and what this does is shorten the SCM muscle, which is, I can never kind of get it, this big muscle here. It shortens that, which will pull us out of alignment. It is a strong muscle. And then it really creates tension in little tiny muscles at the back of the occiput, the pointy part of the back of your head, that have to work really hard to hold your head up. So it's a combination of all of that. And even, if you think of the stagnation idea, even if you start just a very small range of motion and let it slowly get bigger. And I like to do that with the head rolls. Sometimes I like to start just a little inch and then let that grow to where eventually you might be going shoulder to shoulder. I don't really ever teach going all the way back, just because of the compression and what I can hear when I do that myself. It's fine to do that if you really lengthen and come back, But if you have disc damage in your cervical spine, my teacher always says, approach that with fear and trembling. Because this is a huge payload that the neck is responsible for, and you can really hurt yourself. So always thinking, letting pain be your guide, where it's fine to do the movement, and we want to do the movement, because if we don't, it's that move it or lose it concept. Yeah, we're getting to, yeah. Does that answer your question? I hope I gave you some. With the upper back tension, and I have to say I'm used to having a lot of low back pain. When my upper back hurts, it's a whole different kind of pain that I find it's harder to get away from because it's right by your head, and it drives me nuts. A lot of, because we tend to live more forward, strengthening the rhomboids, squeezing them together, that helps. And even, I'm a big believer in using the support of the chair. So coming back, opening the arms, leaning back, and then coming up. Going back and forth, doing things like that. And for the sciatic and the low back, hugging the knees in and releasing repetitively, because that will, I really feel that heals the discs, but it will also break up osteoarthritis in the lumbar, which could be contributing to some of the sciatica. And then the pigeon stretches, where you're going across, back and forth. If sciatica is acute, and I learned this from a teacher, I've been lucky, I've never really had severe sciatica. I've had little tastes of it, and thank you. But I had a prenatal student, a lot of pregnant women get sciatica, and she said it works like a charm. You start here slowly, and then you get to where it's fairly rapid, and do that for 10 minutes. The piriformis just kind of goes white flag, I get in, and releases.
Like you wear it out.
Mm-hmm. Yeah, going back and forth. So that might be something to try. Just be careful of your knee, to really keep your ankle flexed. Okay. All right. I was hoping to do more movement, but I tend to have, so I hope it was valuable. I'm here if you guys want to answer or ask any questions. If I don't know the answer, I'll research it, or I can make something up.
Would you say something about pillows in bed?
Oh, yes. And I have to say, I was getting a lot of, I'm a side sleeper. And I have a lot of friends who are massage therapists. I highly recommend that. One of them was saying, when you sleep, he said, put your pillow high enough so that it is the length from my ear to my shoulder. And that has helped me tremendously. Do you sleep on your side or your back?
I sleep on my back, and I try not to use a pillow.
Okay.
If I have anything, it's a little like a camper's pillow that goes under my neck.
I think that's actually good. It's a lot better than if you're up like this. If it were me, and this is where, do you guys do Shavasana on the floor with your legs on the chair? When you do that? So take a look at my head, and this is just to do with my cervical spine. If I just come back, see how I'm kind of on the crown of my head? That's really, again, it's in my voice. So I can kind of correct that lengthening. But for sleeping all night, it would be a deck roll or something. And what I like about that is it really helps keep the natural curve in your cervical spine. I think that's a lot better than having it way up. Does that answer your question?
So I just think
Yeah.
that pillows are an important issue. 'Cause
Yeah.
If you're sleeping like this all night long, what
Right.
does that do to you?
I have it under my knees.
Yeah.
Yeah, and that's really good too.
A nurse once gave a lecture, and she said the only purpose for the pillow is to put under your knees.
Yeah, I have to say, and even, I'm gonna have to apologize to my husband because I would make fun of how puny his little pillow, it's like a little feather. I'm like, why bother? But
Yeah.
he sleeps mainly on his back, so that's actually better for him. Yeah.
And I heard a doctor once say that if everybody would put their shoes on like like this.
Yeah.
Nobody would suffer from sciatica.
Right, and you're not,
Like that?
Yeah.
yeah,
Just put them on that.
It's not ladylike, which is why we didn't learn how to use it. Yeah.
I wanted to ask a question. Speaking about the neck support here, what I have been doing for many years, I got a soft little towel and I roll it up and I make it into a U shape, and that really helps your neck.
yeah, yeah. I think the main thing is to feel
Yeah,
supported.
just so I feel very uncomfortable sleeping on the side, so that does give me a
Yeah.
good support. So I've been doing that for.
I like those pillows too that have the
little
neck
ridges.
curve, and you've got to get the right size, yeah.
The towels is more softer,
Mm-hmm,
you know,
yeah,
softness of the towel.
yeah,
It's hard to get the right pillow.
it really is.
I must have done 50 in my life. I'm
Yeah.
covered full of pillows. They're all wrong.
We'll have a pillow fight over it.
So I have, Justin, I didn't quite understand, you said when you sleep on the side, where is the pillow, where does it end? You said you usually.
I have it, it's actually quite thick. I have one of those, the ones with the neck curve in it.
Curvy.
And then I have a thicker foam one, like
Yeah.
not the real squishy kind. And I lay so that as I'm on my side,
Mhm.
the pillow comes all the way up to here
Close your head.
and supports me so that I'm not compressing so much here. Ah, thank
Yeah,
you.
yeah, thank you.
See how here I'm like, so I might even come up here and it might be up this far.
Oh, I see, so your head and is straight.
Yeah.
It's
Mhm.
straight.
Yeah, rather than
Mhm.
off to one side. And that's made a huge difference because, you know, he works on my body, he knows where I get the tension and he's like, what the hell? Yeah, that's made a huge difference for me.
I just bought a new pillow, my 51st. From Costco, and it was like $25 or something. And yeah, it's a very sturdy, and it has a little cutout, goes around your neck.
Yeah.
And then when you put your head down, it's like an extension of your body. Your neck doesn't go down.
Yeah.
And it's great. I think that's better since I've had that.
I'll check that out at Costco because, yeah, it makes a huge difference because if you're not comfortable sleeping and you're not getting into the REM, yeah.
Is it foam or is
Yeah,
it
but it's very
Firm.
firm.
Yeah.
Costco.
I haven't, yeah, I live there. That's.
I know.
She's me on Facebook.
I'm gonna start sending you like, hey, can you pick me up this? Yeah.
I may have to go there.
It works for me. I don't know if it would, because I have friends who swear by feather pillows.
Right,
Yeah,
yeah.
I hate those things.
So your pillow with the cutout, do you have the cutout next to your face or do you have the flat pillow?
I have the flat pillow next to my face.
That's how I have mine.
Yeah.
That's, I have one. And then
Yeah,
the flat
okay.
pillow is.
Thank you for coming.
Thank you.
Thank you. All right, thank you.